Hi, everybody. This is Dr. Simon Middle. I hope you're having a great day. And we are going to talk a little bit today about the sex hormone estrogen. And as you may know, this month in Empowering Minds, we are working on the sex hormones. And often when we talk about estrogen, we always think about it from a reproductive standpoint in terms of menstrual cycles. But we also want to kind of be aware of what this does for both men and women, but also the other impacts it might have in our overall health and what we can do to really regulate it. Now, it's important to remember that with estrogen, it's actually an essential hormone for both men and women. And so even though we talked a lot about what the impact in men, it's really important for you guys too. And so when we have problems with estrogen in men, that also creates some symptoms and problems that we'll talk about today. So the first thing I want to kind of talk about is that estrogen is managed by two other hormones called luteinizing hormone, LH, or follicular stimulating hormone, FSH, which is released from the pituitary gland, which in of itself is actually then controlled by the hypothalamus through what's called a gonadotropin releasing hormone. All of that is unimportant other than to say there's a whole cascade of hormones that really relate to how estrogen works in our bodies. And estrogen is not at a consistent level for women. It goes up, goes down, and part of that is because of how it works in the menstrual cycle. Now, estrogen is also important in development of embryos and fetuses and human beings because the exposure of the baby inside the womb early on in development regulates the female reproductive system, promotes the growth and maturation of the ovaries, fallopian tubes, the uterus, and vagina. It's also important in what we call secondary sexual characteristics, which is the things such as the distribution of body fat and breast development in women, and also can be important in secondary sexual characteristics in men, especially as it pertains to libido. So again, it has some really important things. It also, obviously, estrogen rises to very, very high levels during pregnancy to help maintain the uterine lining that supports the development of the baby. And so, very important hormone. And when this can get blocked or it doesn't get produced at high levels, there can be problems with pregnancies as a result of that. Estrogen is also important for development in the breast tissue for breastfeeding and as we prepare for that. And lastly, for women, estrogen is really important in maintaining bone density. And so that's one of the reasons that when women go through menopause and there's a decline in estrogen levels, we really want to think about bone health and how is that working and how are we promoting bone health in the postmenopausal or menopausal timeframes. In men, estrogen is really important for the production of sperm. It's involved in what we call spermatogenesis, or the production of sperm. And so really important in terms of fertility, in terms of how men function. It also has a significant impact in libido. It has some impact in women in libido, but it unfortunately has just not been as well studied. And so we don't really know all the ins and outs of how that happens in women. But we do know it has a significant impact in men. So as we said, in women, the ovaries are really stimulated by estrogen to produce eggs. But we also know that there is estrogen that's produced by the testes in men, and that becomes important in terms of some of the other functions we've talked about. This production of estrogen actually has an impact then on these other hormones in the brain, which then creates what we call a feedback loop to make sure we've got the right hormones at the right times. So we know there are lots of factors that can actually influence estrogen levels, things like stress, illness. There are other environmental factors. We know that some medications can impact that. The amount of fat tissue we have also can impact the levels of all of our sexual hormones, but specifically estrogen. So we know that's important to maintain normal regulation of estrogen, as it really has an impact in health beyond just sexual reproduction. So, when we think about this, then we talk about, well, how do we manage this? And, again, you're going to hear sort of a common theme. The first one is that we need to eat a balanced diet. What does that really mean? Lean proteins, fruits, vegetables, and healthy fats really support hormonal balance. So we want to avoid excess consumption of processed foods, sugary snacks, and trans fats. Specifically, there are specific vegetables that also seem to help with our regulation of estrogen: broccoli, cauliflower, Brussels sprouts, kale. And these contain a compound called indole 3 carbinol, which helps the body metabolize and eliminate excess estrogen. Fiber, we think that a high fiber diet helps us maintain regular bowel movements, which aids in the elimination of estrogen metabolites, which can have a very similar effect to estrogen. And so it can tell our body we actually have high estrogen levels when in fact we don't. And then the other thing is flax. We know that flaxseed is what we call a phytoestrogenic estrogen, and this has properties that can help modulate estrogen levels as well. Having a healthy weight is really important because we know that excess body fat, especially around the abdomen, can lead to high levels of estrogen, because we know that fat cells convert androgens, things like testosterone, into estrogen. And so that's why there is sometimes excess breast tissue development in men, because some of the testosterone is actually being converted into estrogen. So that really means then how are we managing our weight? With exercise, with diet. We think strength training can be beneficial because it helps with, as we know that there's metabolism of some of the sexual hormones in muscle tissue. And again, stress reduction techniques, deep breathing, mindfulness, meditation can have a significant impact in hormone equilibrium. We know that the adrenal glands, which is where some of the stress hormones like cortisol are produced, also have an impact in how some of the sexual hormones are produced as well. We know that alcohol and caffeine can have a significant effect. We know that alcohol actually blocks the effects of testosterone, and so it increases the body's signal to estrogen. And when that happens, that actually has some significant effects as a result of that. We know that some toxins, such as BPA, which is found in some plastics, can actually mimic estrogen in the body. We know that certain pesticides can do that. And so again, we want to be really aware of some of the things we're putting in our body or that we're using. We know that some herbal supplements like chasteberry or black cohosh can have some estrogen modulating effects. And sometimes that can be used to manage hormonal imbalances, especially in the perimenopausal or menopausal symptom management side. And then there are some medications that can really be impactful. Again, when we think about postmenopausal for women, and the low estrogen leads to a decrease in bone density. So sometimes we'll think about estrogen replacement in that time frame. Now, there are some concerns around that related to potential risk of breast cancer. And so if you have a strong family history, I would really recommend against that. But again, I would have that discussion with your physician, primary care provider to really talk through what the risks benefits might look like. So again, estrogen in men tends to be lower. Again, we would expect that. But we know that when we have high estrogen in our bodies, we can have, as men, we can have gynecomastia, which is enlargement of the breast tissue, a decrease in our libido, mood swings, irritability, fatigue, and erectile dysfunction. Low estrogen can actually lead to osteoporosis, muscle loss, can actually change our cognition, mood disturbance, and cause some significant joint pain. We know that obesity, liver disease, and thyroid disorders can also lead to estrogen imbalances in men, along with other testicular disorders. We also know that anabolic steroids and some anti-androgens, which are sometimes used in supplements, can affect estrogen levels in men, and that can actually be very, very detrimental as well. So, how do we do that? How do we monitor hormonal health? I think part of that is making sure that you have regular checkups with your healthcare provider and really monitor your symptoms. If you're having fatigue, if you're having erectile dysfunction. Now, I will say this, most erectile dysfunction is not related to hormone imbalance. It's actually related to two main things. One is blood flow and the other is psychological issues are actually the most common. So again, we want to be aware that this, just because we think about this, doesn't mean it's always the cause. So again, as we talked about in premenopausal women, there's a significant fluctuation of of estrogen, and that's normal. There's what we call a follicular phase where estrogen levels are relatively low, and right around the time of ovulation, estrogen levels surge. And when that surge happens, that's when ovulation typically occurs. And then we have a drop slightly, and then it slowly comes back to a baseline. And primarily, it's because if pregnancy does happen, we want to make sure we maintain the uterine lining. In menopausal women, there's again these lower levels of estrogen, and that can fluctuate a lot before you actually hit menopause, and that's where some of the mood swings, hot flashes, vaginal dryness can really happen. And then during menopause, which is defined as 12 consecutive months without a menstrual period, that's where there's a significant decline in the release of eggs from the ovaries, and typically can again have some of the night sweats, hot flashes, and changes in bone density. But we also know not only does it have physical effects, as we've talked about, we know it's important in puberty, it's important in growth spurts, it's important in breast development for women. We know obviously it has an impact in pregnancy, but we also need to be aware of the fact that estrogen, as it fluctuates, has significant emotional impacts, can have significant mood swings, especially in that time that it's that estrogen is kind of leveling off. It can really affect the mood. It can really affect emotional changes during the time of puberty. So if you've got your teenagers who are having ups and downs, part of that is going to be because of the fluctuations in hormones. These mood changes are really related to the hormonal shifts that happen. It can lead to irritability, anxiety, and depression. Again, so the more that we can help to regulate ourselves with diet, exercise, making sure we're really watching our weight, especially that abdominal fat, really working on trying to get that down, that can really have a significant improvement in our ability to manage our estrogen. That's a lot of information about estrogen. I hope this was helpful in some ways. And if there's ever any questions, please feel free to include that somewhere in our Empowering Minds network. I can assure you, if you've got the question, other people do too. And so the more we can answer those questions as a community, I think the more that we'll actually see that a lot of us actually have very similar questions and concerns. Again, this isn't meant as an education, not as a medical advice. This is really designed to provide you with support in decisions you're making around your own health, both emotionally and physically. And again, I hope this has been helpful. And next week, we'll be talking about progesterone, which is the other primarily female sexual hormone. And then we'll be talking about testosterone. I'm glad that you have watched this, and I look forward to our next session. Have a great day.